Hi, I'm Larry Williams with Health Matters. Health Matters is a show addressing health and wellness topics relevant to Lincoln's culturally diverse communities. Today's episode looks at the Minority Health Initiative, its purpose, the key organizations involved, and ultimately what we should know about this program. To start things out, we're going to talk with Dave Hum from the Lincoln-Lancaster County Health Department to learn exactly what the Minority Health Initiative is all about. Welcome, David.
Thank you.
Why don't you tell us a little bit about yourself, and then you can go in and talk about the Minority Health Initiative.
Sure. Well, my background is in community health education, secondary teaching. I've been in public health for about 15 years. I've been at the Lincoln-Lancaster County Health Department for about 8 years, working in adolescent family health, tobacco prevention, and now currently in chronic disease prevention.
Okay. Let's talk about the Minority Health Initiative. What is that program?
Sure. Well, this is a community collaborative amongst many partners that you'll hear from later in the show. Basically what we're trying to do is reduce health disparities with regard to cardiovascular disease and diabetes. So we have a grant that we have since 2005 received funds from the Office of Minority Health, which now is the Office of Health Disparities and Health Equity with DHHS. And again, with those funds, our partners work together in trying to find basically what our goals are, is to find outreach to people in need with their health needs and finding them a medical home and dental home. That's our ultimate goal, so they can get ongoing care and have that preventive care, so we're preventing these chronic conditions from forming in the first place.
Okay. Well, so what's a typical day like for you in working in this program?
Sure. Well, as a health department, we kind of oversee the grant and making sure that everything is working properly, and our partners are serving the populations and getting the resources to our partners that they need to serve. So basically with again, looking at our partners and with the cultural centers, which you'll hear from, the Asian Center, the Malone Center, and El Centro de las Americas, they do the outreach part of it. So we're providing resources to them so they can reach the populations. They're the experts, so we rely on them to kind of do the outreach. The second part of it is kind of the case management or the service. And so we also help Clinic with the Heart. Of course, they serve a large number of the population that we're looking to serve in the health needs. People's Health Center, and also Lancaster County Medical Society. Those are kind of our other partners that kind of help provide this direct service.
Now, you mentioned that this program is funded by a grant, and I'm assuming this is from some federal agency?
Actually, again, it's kind of funneled through the Department of Health and Human Services, but actually the source of the funding is tobacco settlement funds, is kind of the source of the funds. Okay.
So what are some of the goals and objectives that have been achieved from this program? I always think our listeners would want to know, why is this program is important, and what have been some of the results or benefits to the community?
Sure. Well, again, I mentioned kind of medical home and dental home. That's kind of the ideal situation. Everyone should have a primary doctor and a primary dentist to get those preventive services. If someone is sick and they don't have a primary doctor, they don't have a resource to go to, so they have to either go to the emergency room or just to get some basic care. So having that medical home, they can get the services they need immediately rather than waiting and something developing. So that's kind of the purpose for it. What we've seen actually over the last 5 years, we've actually helped about 3,500 clients get medical homes, and over 3,800 clients find dental homes. And so there's been great success. Now, once somebody gets a medical home or dental home, then what happens? We've also seen since 2009, 63% of new and existing clients at People's Health Center, they've been able to achieve a behavior modification, meaning reducing a risk. So they've either increased their physical activity, improved their nutrition, maybe they've lost weight, maybe they've quit smoking. So there's a large percentage that have seen success, and that's what we want. We want them to have a medical home, reduce their risk, and be healthier.
Are there any other statistics that you would like to share with us that you think would drive home the point and drive home your argument that this is a really important program for our community?
Well, again, we'll have some of our other partners that'll talk specifically to the populations they serve, but really there is a need. There's many new immigrants, refugees in the community. There's increasing populations of Latino population, and there's health needs, and we need to work together to be able to serve the culturally diverse needs of these populations, and that's why it's so important that we're all working together. And to me, I guess that's the biggest part of this collaboration, is that there's so many partners working together towards this goal. A lot of times in the community there's competing things and everybody trying to do their own thing, and in this case we have come together and tried to make a difference. Okay.
Collaboration is good.
You can't argue with that.
Okay. Anything else that you would like to add that you think our viewers would be interested in knowing that we haven't covered regarding the Minority Health Initiative?
Well, again, I think with these partnerships, it's also developed new partnerships. That's always a key. And with looking at how the health department and public health in general, we can't do it alone. When we say public health, it's really the whole community. It's not just the state health department or the local health departments. When we look at public health, there's a public health system in place. And that's, I think, what's great about Lancaster County, is that people work together in this public health realm. And so I just wanted to emphasize that that's the point, and that's how we're working through this project.
All right. Well, thank you, David. Thank you very much for taking time out of your busy schedule to be with us. And viewers, we'll be right back. In our next segment, we're going to talk to minority health outreach workers and see exactly what they do with the Minority Health Initiative program. Stay tuned. Welcome back to Health Matters. In the second part of the program, we're going to be talking with health outreach workers in our minority and diverse community. Our guests in this segment are Regina, Roy, and Len. Welcome so much to Health Matters. To start off, let's introduce ourselves and tell us a little bit about yourself and why you're interested in this program or how you became a member of this program.
My name is Regina Sullivan. I'm the Health Outreach Specialist for the Malone Community Center. Born in Omaha, raised here in Lincoln. Graduated from Southeast Community College and was looking for a job and applied for the position of Health Outreach Specialist. I have been doing it for 2 years now, and my job is to throw events in the community to make people aware of the services and get people a medical and dental home.
Okay. And you're affiliated with the Malone Community Center?
Yes.
Okay. Roy, again, could you introduce yourself and tell us a little bit about yourself and how you came to be a health outreach worker?
Sure. My name is Roy Rivera, and I am the Health and Education Coordinator for El Centro de las Americas. I was born in Honduras. I have been living in Lincoln approximately 7 years now, and ever since I came to Lincoln and through the experiences that I had in previous jobs, I realized that there's a need for the Latino Hispanic community to learn more about the services that Lincoln has to provide in regards to medical homes. Okay. And my job is to engage the community, the Hispanic Latino community, in events, and through these events just let them know about all the different services that they can get through medical homes here in the city.
Okay, thank you, Roy. Len, again, if you could tell us a little bit about yourself and how you became a health outreach worker.
My name is Lin Bui from the Asian Community and Cultural Center. I born in Vietnam, and I came here in the United States 7 years ago, and I work at the Asian Community and Cultural Center under the Minority Health Program for 4 years. My job is to provide assistance to Vietnamese refugees and immigrants who are struggling with accessing healthcare services, and they have a lot of health issues due to the language difficulty, cultural differences, and complex healthcare system.
Mm-hmm.
So, as a health outreach coordinator under the Minority Health Program, I work to bring more health service and health education to my community.
All right, thank you very much, Len. I always think a really good question is to tell our viewers is what is a typical day like for you when you're doing your job as a minority health outreach worker? Roy, we'll start with you. What's a typical day like for you in working on this program?
Well, a lot of the time is just trying to create and promote events, you know, just to get our community involved, trying to see how we can make sure that everyone in the community knows that even if they are underinsured or no insurance at all, they can, you know, they can use all these services. So that's one part. We also help out at El Centro, just receiving these persons that have received this this information. They come in to fill out applications and get more information about how to deal with, you know, like Lynn said, it's a complex healthcare system. So a lot of people don't know how to go about, you know, getting these services. So we help them a lot with that, and just, you know, go out there and promote this information.
Mm-hmm. Regina, what would you add to that?
I would add that a lot of case management is involved with getting our clients to follow up, keep appointments, and things like that. In throwing events, not only do I invite other participants in the community to come and share resources that they have. We're not the only resource. There's, excuse me, Clinic with the Heart and the Health Hub and other things like that that people are just not aware of that are resources to get healthy in Lincoln.
Mm-hmm. What other resources are there? You mentioned Clinic with the Heart.
Yeah, I have, there's Family Health Services, American Cancer Society, Every Woman Matters. There are just a number of health resources in the community that are here to help us stay healthy, and, you know, most of the resources are either free or on a small scale.
There's also the People's Health Center.
And the People's Health Center, yes.
Okay. Do you help a lot, Len, with paperwork? I just think sometimes the paperwork involved in receiving medical assistance and health assistance can be overwhelming.
Yeah, more of the time, because most of the clients I serve don't speak English.
Mm-hmm.
So they rely totally on someone else to do all those things for them. Every day, my mainly job is provide a language service to not just medical field, but others like public assistance and immigrants, other things. Every day I call doctor office to make appointment for the client, make the phone call to agency on behalf of client for like follow up on the case, or communicate with the healthcare provider for medication change or some health issue, and help them to fill out some medical paperwork, and I don't know, a lot of things that language need.
Mm-hmm. Okay, thank you, Lynn. Roy, I think that would be one of the challenges that you would also have. You work with many of our Hispanic and Latino families. Maybe you can talk a little bit about some of those challenges that you have in working with the paperwork and also working with families.
Yes, definitely the language is a difficulty, because a lot of organizations do provide the paperwork in Spanish, but still they, you know, some people would like the assistance to help them out through the application process. Some applications tend to be long. Sometimes the language that it's used is kind of difficult to understand. So they would like for them to have someone there that can confirm or kind of somehow explain what the application means, what some of the requirements are, and just being able to, for them to go and visit you and know that they can, that you can answer all those questions for them.
Mm-hmm.
And definitely, like Regina was saying, the follow-ups, making sure that they are attending this, the appointments that they have gotten. We know that there's a high demand for services, and we need to make sure that all the applicants that we send to the different medical homes are taking advantage of their appointments, letting them know it is very important for them to go and use the services, because if they don't use those appointments, they're taking that space from someone that
Mm-hmm.
needs it equally but doesn't get that opportunity because that spot has been already taken. So that's some of the paperwork that we have to do as outreach workers.
Mm-hmm. Regina, I think you've also talked a little bit about that. Maybe you can expand upon working with your clients and your customers and making appointments and making
Right.
sure they follow up.
Right. I just want to stress that it is so important to have preventative care, and this is why we are all here, because we don't want it to be at chronic stages, whatever your illness may be, and then it's too late. So this is why we call and follow up and make sure you're keeping your appointments, and if there's any barriers, we try to break them down and work with you and do as much as we can to help you stay healthy.
Mm-hmm. That brings us, I think, to one of the important questions I think that many of our viewers would have, and that would be, why is this program important
Right.
to our culturally diverse community? And I think you hit upon one of them, that preventative care.
Yes.
Anything else you wanted to add to that?
Also, the awareness. I think it's just so important that we are aware that these services do exist along with others, because it seems like Lincoln is really good about keeping health-related issues out there and the resources, and something that we can all work with together to stay healthy.
Mm-hmm. Lynn, what do you think? And what would you like the viewers to know about why is a minority health initiative important to this community?
To my community, I think the healthcare system differences is a challenge, because like some term like medical home, medical appointment, preventive care, or prescription medication, or medical referral is a new concept to refugee and immigrant who came from a country that you can go to the doctor office without appointment. They just receive you and walk-in basics, and you can buy the antibiotic at over the counter.
Mm-hmm. Mm-hmm.
So I think the education is very important.
Mm-hmm. And so you're able to bridge that gap where those terms are just foreign to many of your clients and customers, and so they understand why it's important to keep your medical importance, preventative health, so forth and so on.
Yes.
Okay. Roy, what do you think? Anything you'd like to add?
Yes, I believe that one of the problems in our culture is sometimes we're afraid to go to the doctor, or we just let it, we might feel a little pain, but we decide, it'll be fine, it'll go away, and we just don't go because we think it's harder than it really is to get medical assistance, and that's something that's important. We want to make sure that we practice prevention, we practice periodical checkups. At the end, it's going to be way more expensive, in regards financially to quality of life, if we wait to a point where we injure ourselves or we become sick because we didn't practice prevention when it could have been, when the solution could have been faster, it could have been less expensive financially, quality of life, and for you and your family. Mm-hmm. So that's something that we really need to have our community know, that we need to practice prevention, do periodical checkups, and this will keep not only money in your pocket, but keep you living a healthy, happy life for you and those around you.
So I think if we could summarize, we would say, first of all, prevention is a key, important product and outcome from the Minority Health Initiative, and also working with the different cultural environments, which might have language differences, cultural differences, whatever. That's another important benefit. And in the end, prevention is a key.
Yes.
Sounds pretty good? Okay. Anything else you want to add on that before we wrap up here about why this program is important to our community? Okay. Thank you very much. Now we have a few minutes left, so maybe you can tell us a little bit about some of the events that are upcoming in the next couple of months.
We have Juneteenth coming up in June. I'm also having a
Now what's going to happen in Juneteenth?
Juneteenth, there's a health fair, from 11 to 1, and there will be a number of different health fair participants there to educate the community on what's available.
Okay.
And then in August, we'll be having a back-to-school jam for the children, and I'll also incorporate a health fair within that too. And then Angelic Temple has decided to have a health fair at the Malone Community Center as well.
Okay.
So we will educate people on a Saturday afternoon on different health resources, and this is our first time getting in a church to get healthy resources in there, so I'm excited about that.
And people can call the Malone Center
Yes.
and get more information about these upcoming events over the summer months.
Yes.
Okay. What's going to happen at El Centro de las Americas?
Well, right now we're very excited to start our spring summer bike tour.
Right.
It's a family event. Everyone is invited. There's 9 sessions involved where we're gonna go around the trails, go around town, go into different points of interest in the city that are related with the arts, health, nutrition, and this is something that even if somebody doesn't own a bicycle or a helmet, they're more than welcome to call El Centro, and we can arrange for them to have a bicycle when they come in so they can join us. There's no registration required. It is encouraged if somebody doesn't have a bicycle or helmet to give us a call beforehand, letting us know so we can plan accordingly. Again, there's no cost, and anybody can attend. They don't have to attend the 9 sessions. That's what we're aiming for. But if they can attend to the second one, then to the 8th one, that's totally fine with us. We just want to, make sure that our community goes with us, enjoys all the nice trails that Lincoln has, all those points of interest. So, and they can go ahead and visit our website or call El Centro for more information or to register.
Along with the bike tour, any other programs that you have going on in the summer months?
Right now, we're trying to get something together for later on. We're planning on having hopefully a bike tour, fall, winter bike tour. Before that, we're still working on some things that we want to plan out, but nothing concrete at this moment.
Okay. And Len, if they want more information about some of the activities going on at the Asian Cultural and Community Center, they can also call you there.
Yes.
And anything in specific that's happening that you'd like to share with our viewers, or normal programming?
Yes. At the Asian Community and Cultural Center, we organize every month. We working very closely with the health department, and we have nurses come and do the health screening, checkup, like blood pressure checkup, cholesterol, or blood sugar checkup. And I also work with other agencies to invite speakers coming to talk about health topics, like giving some health education presentation on different health topics like heart disease, diabetes, eating healthy, and so on.
And for more information, they can also call the
you can call the Asian Community and Cultural Center. And ask for Lynn. My phone number is 424773446.
Okay. Thank you so very much. Thank you, Regina. Thank you, Roy. Thank you, Lynn, for sharing what it's like to be a health outreach worker with our various cultural centers. We will be back, and in our final segment of this program, we're going to talk to some of the folks who actually run some of the providers of actual medical services here in our community. So stay tuned. We'll be back in a moment.
Hi, my name is Olga Miranda, and I'm working in the Hispanic Center for 4 years. And I'm working as a client support specialist, and I used to be a cook and my chef in my country, and I love to cook. And today I have my recipe, and I call sopa de vegetales y pechuga, and we can call chicken breast soup with vegetables. I can show you my my ingredients. This is the chicken breast. We cut it in little pieces. Onions, we cut it in little square pieces, and green pepper, and a clove of garlic. We can cut in little tiny pieces. And we have a tomato. We can cut it the same way too. And we have a cilantro. And we can put black pepper, and also consomme de pollo, and we don't use any salt because these already have salt. 3 or 4 cups of water, and potatoes, carrots in a square too, and we're gonna add the celery and culantro. And after this vegetable already cooked for 10 minutes, we are gonna add the broccoli. And that's the final ingredient we're gonna add it. The chicken breast we're putting in a pot and a medium heat and with vegetables. First we are gonna put the chicken breast, and we can add the tomatoes, the onions, green pepper, and garlic. But the garlic, we need to cut it in little tiny pieces. And we are gonna stir fry this for 10 minutes. We are gonna add the cilantro. We can use the knife, or we can use our hands to do it, to cut it and add it on the soup. Now we are gonna add the black pepper as a taste. That depends how much you want to add it in your soup. And the chicken flavor bowling. We are gonna add 1 square. We are gonna cook the chicken breast. We are gonna stir fry for 10 or 15 minutes. And this is chicken breast. We use my home country. My home country is Honduras, Central America. That's everyday dish, and we can use more in winter time because it's a lot of influenza, and a lot of people they've been sick with they come and be sick with cold, and you can use this soup as, you know, to recovery after you get sick. I'm gonna cover for a few minutes. That way we're gonna keep it, you know, the flavor in there. Now we are gonna add it our water. This I made it for 4 or 5 people. If you want to make a bigger dinner, you can have a big pot and you can put more vegetable. You can put like 2 or 3 pounds of chicken breasts, and you can add it, you know, the ingredients as you taste. Let boil it for a little bit, and the chicken is already cooked. The chicken breast is cooked really easy. And now we need to add the potatoes, our carrots, and we can add the celery and the culantro. And we are gonna let them boil it for 15 minutes. We can add the broccoli, and our dish is gonna be finish in a few minutes. The soup is finished. It's already cooked. So we can serve. It's ready to serve. And you can see, you can repeat it again if you like it. I know you're gonna love it, and this is, you can have again for dinner and for lunch. And you can combine it with rice, white rice, toast bread, tortilla, corn tortilla, and it's ready to eat it. The smell is so great. You can taste it.
Welcome back to Health Matters. In this segment of our program, we're going to speak with 3 representatives from healthcare providers in our community. We have Teresa, we have Corey, and we have Gwendy. Welcome. I think to start off, why don't you talk a little bit about yourselves, each one of you, and tell us what organization that you're with, and then we'll go from there. We'll start with Teresa.
Okay, I'm Teresa Harms, Executive Director of Clinic with a Heart. I've been with Clinic with a Heart for 4 years. And before that, I have a healthcare background. I've worked at Madonna, St. Elizabeth, and Emeritus in a healthcare role. And my background is marketing.
Thank you, Teresa. Corey.
I'm Corey Keelty. I'm from People's Health Center. I've been there for 2 years, and previous to that, I have over 20 years of experience in human services and public policy, mostly public health.
Okay. And Gwendy.
I'm Gwendy McGinnis, and I'm with the Lincoln-Lancaster County Health Department. I manage the Division of Dental Health and Nutrition Services. I've been with the Health Department for 28 years. My background is dental hygiene, and I'm a licensed dental hygienist with the state of Nebraska.
Okay. Many of you provide services to the clients and customers of the minority health outreach workers. So maybe you can talk a little bit about the type of services that you provide for many of the clients that our health outreach workers bring to your front doors. We'll start with Corey this time.
Okay. People's Health Center is a medical home. We have a dental and a medical clinic. And in our dental clinic, which is open every day of the week until 5 and until 7 on Thursdays, we provide all dental services, cleanings, x-rays, checkups, fillings, root canals, but we don't do dentures or bridges. And on the medical side, we are, as I said, a medical home, and so we provide everything that a doctor would provide if you have your own doctor. We have 7 full-time providers. Then we also have prenatal care. 2 days a week, we have 3 OB midwives that come to the clinic and provide that care. We have pediatricians who are with us on a part-time basis to see children. And we also have specialists who visit the clinic usually about a half a day a month. There are 5 specialists who come to see our patients who are uninsured because it's so difficult for them to be able to go to specialists without insurance. So they're there to be able to provide a neurology visit or an OBGYN visit or a visit where they need to see a specialist but they just don't have the funds to be able to afford that. We also provide specific services for our uninsured and underinsured that aren't covered by their insurance. For instance, we have diabetic education. We have a full-time RN that provides diabetic education so she can help them get started on their medications, talk with them about their diet, and about checking their blood sugars and how often they need to do that. And there's no cost for that service at all. We help our patients who need medications to be able to get those at low cost or at no cost. And we also have case management services to help our patients. Maybe they don't know that there are some benefits that they might qualify for, like Medicaid or general assistance, and we help them apply for those services.
Okay, thank you, Corey. Wendy.
We have a dental clinic at the Lincoln-Lancaster County Health Department that serves low-income, uninsured children, families, pregnant women, and other adults that are unable to access dental care. We are a dental home for many. We operate it on a sliding fee scale based on household number and household income. We have general dentists and pediatric dentists both on staff. We are there Monday through Friday, 8 to 4:30. We also have dental hygienists on staff as well, and we do many similar services as People's Health Center. And for those services that we're unable to provide, we have other partners, such as the College of Dentistry, as in the case with dentures, that will make appropriate referrals, that they also work with this Minority Health Initiative and grant.
Okay. So People's Health Center and Lincoln Lancaster County, the dental service can be medical homes for clients and customers.
Yes.
Okay. Clinic with a Heart is not a medical home, but it can provide services for many, many people. And maybe you can talk a little bit about what you provide and the difference between the medical home and what you do.
Correct. We're an urgent care clinic, so not a medical home, as you said. We have clinics Tuesdays and Thursdays in the evening, 5:30 to 7:30. And what's unique about us is we have the equivalent of 2.75 employees, but 670 volunteers who converge upon 1701 South 17th Street and provide care to our community. And so we're kind of a funnel for patients or people who need health care and don't know what to do next. So we provide care, and then we also refer to the medical home providers in the community. We offer medical, dental, physical therapy, chiropractic, vision screening, hearing screenings, mental health. So a variety of services on a rotating schedule, so it's different each night. Each night of service is a mission team that's coming to the clinic and serves as a team, so they serve once a month, each team that comes. And we'll see anywhere up to 50 patients with anywhere up to 50 volunteers. So you get a lot of good attention when you're at Clinic with a Heart. We're no questions asked too, so we don't want to create a barrier to people. So we don't ask for identification, we don't ask for proof of income. So we're a kind provider too. It's easy to get into us because it's not always easy to get health care.
And the teams that come and provide services are all volunteers?
They're all volunteers.
Okay, all right. You have paid staff, correct. All right, maybe you can tell us a little bit about how many clients are you seeing? How many folks are you providing services to? We'll start with Gwendy.
Well, on a typical day, we're offering probably 40 to 50 appointment times. Last fiscal year, we provided about 8,900 patient visits, and that was for about 3,200 patients. So on any given day, we usually run anywhere from 1 to 3 dentists. So it can vary from day to day, the number of appointments. We could be as high as 60 appointments in a day that we're offering. And we have 2 full-time dental hygienists and 1 part-time and 3 dental assistants. So we're pretty busy in our clinic.
And where is the clinic located?
It's 3140 N Street.
Oh, in the county health department?
In the health department.
First, second, or third floor?
First floor.
All righty, okay. Corey, what about you?
Our clinic is located at 27th and Y Streets, and there's a dental entrance and a medical entrance. The medical clinic is open 8 to 7 each day and 8 to 5 on Friday, and we're not open on the weekends. We see in the entire clinic about 160 patients on average a day. And those are for all of the different appointments. It may be for an x-ray appointment, it may be for a lab appointment, doctor's appointment, or a dental appointment. We opened in 2003, and in those almost 9 years, we've seen almost 28,000 people in our community.
28,000. Okay, and again, could you go over those hours one more time?
Sure. The medical clinic is 8 to 7 Monday through Thursday and 8 to 5 on Friday. Did I say medical clinic? And the dental clinic is 8 to 5 each weekday and 10 to 7 on Thursdays.
Okay. Teresa, in your opinion, what's the importance of the Minority Health Initiative program and the relationship between that program and what you're doing at Clinic with a Heart?
Well, and as you said when you talked to Dave, collaboration is important, and it does build partnerships. So we work with each other, we connect with each other, and we understand each other's services. That is important, especially when we're referring back and forth, and we want it to be as easy for people as possible. So the Minority Health Grant puts us all around the table to understand what each other, what we do. I think it's probably increased all our capacity to serve too by working together and knowing what our strengths are and what other agencies' strengths are.
What do you think, Wendy, about the importance of the Minority Health Initiative to community health?
As Teresa's mentioned, it's brought together the partners. I think we are working more collaboratively. We have, for example, a dental group that meets on a regular basis to case manage and make sure that we're making appropriate referrals and maximizing use of our community resources. We don't want a duplication of services because that really doesn't benefit the community. So we want to make sure that we're serving the most people in need. So it has really been a great partnership and collaboration.
I was not aware of the dental collaboration, so the providers get together and sort of determine.
Yes, we have Clinic with the Heart and People's Health Center. We also have the College of Dentistry that is a key partner in this, and we have dentists from the community that volunteer at Clinic with the Heart, and we meet on a regular basis to just go over the dental part of the Minority Health Initiative too, to make sure that we are meeting the unmet needs.
Okay, and I think our listeners find that very interesting because, again, collaboration is important, but also you don't want to be duplicating services and sort of on top of each other like that.
Exactly.
Corey, what would you like to add about that?
Yeah, as you both said, that duplication of services, it's not only inconvenient for the patients who don't have the time for it, but it's also taking our time when we should be seeing patients. And so Lincoln does a great job of not duplicating services, medical services, but also it helps to get them to the appropriate home. For instance, if they know that they need help immediately, they're probably going to go to Clinic with the Heart because they can get in really quickly, and you have to do an application process with us, so it takes a little bit more time. And to know what the differences are. As Wendy said, they have a sliding fee. We also have a sliding fee, and it's confusing to know who has what and what is the right thing. And so if we, as the service providers in the community, are directing people to the right places, it makes it so much smoother, and it guarantees that preventative care that you talked about in the earlier segment.
Again, prevention is key. We have about a few minutes left here, and just want to make sure that we've covered everything. So is there anything that any of you would like to add about the services you provide, about the Minority Health Initiative, that you think our viewers, that we haven't covered, that our viewers would like to know? Teresa, I want to give you that opportunity. Anything else that you would like to say about the Clinic with the Heart, or the initiative, or the collaboration or partnership, or just Lincoln in general in health?
Well, I think Lincoln's an extraordinary community just by the volunteerism, 670 volunteers who are providing care. But I also think a stereotype is that people go to the ER to get their health care. And you know, most of us don't want to get our health care that way if we don't have insurance. So having an agency like Clinic with the Heart and People's Health Center keeps people out of the emergency room and gives them an option. In fact, 47% of our patients say, were it not for coming to Clinic with the Heart, they would have gone to the ER. So it does save the community too, to have these kinds of partnerships and agencies working together.
Okay, before I move on to Corey, again, what's the address, what are the hours?
Yep, 1701 South 17th Street. It's called the Sowers Building on 17th and Sumner. Our clinics, our walk-in clinics, are Tuesdays and Thursdays in the evening, 5:30 to 7. We open our doors at 4, and there's generally a line when the doors open.
All right, thank you so much. Corey, anything you want to add about health in Lincoln, about collaboration, partnership, the Minority Health Initiative that you think our viewers would like to hear or would like to know?
Yeah, I think the Minority Health Initiative has been a huge benefit to our patients as well as to our community. As Teresa said, it saves our community, it saves our taxpayers, it saves those of us that pay for health insurance a lot of money when people come to a primary healthcare home or to an urgent care clinic instead of going to the emergency department, or instead of waiting until their chronic health needs get so bad that they become hospitalized. We all know that that can cost thousands upon thousands of dollars, and you know, maybe $100 to go to get a medical visit. So not only is it cost savings, but it's easier for the patients, and we all work very hard to make sure that we provide culturally appropriate services. As a federally qualified health center, that's part of our mission, and we have interpreters on site all the time, and we work really hard to make sure that we provide the care that our patients need. You know, for me, it's a great education in different cultures because I learn about the differences. You know, we talked in your earlier segment about how different it is in different countries. Healthcare isn't provided the same way. And so we learn and the patients learn, and it's a great partnership for us.
And thank you very much. That is an important part what you provide is culturally appropriate, and in addition to providing language services when needed. Thank you very much. Gwendy.
I was just going to mention the same thing too, that not just having insurance as a barrier, but transportation and also language barriers. So for the health department, we too have been working, we have on-site interpreters, and for those languages that we may not have on-site, we work with Language Link to assure that we then have other interpreters come on site, and working with our staff for a culturally competent workforce. And so hopefully that will not be a barrier. We have a lot of our documents that have been translated too, so I'm hoping that that does not discourage anyone from accessing services. And we also solicit input from our customers too. We always want to know what we can do to be better, and making sure that they are getting quality services with a culturally competent workforce.
Thank you. Thank you, Teresa. Thank you, Corey, and thank you, Gwendy. And also thanks to all of our guests today. Collaboration, prevention, and quality services are all the keys in our Minority Health Initiative in Lincoln, Nebraska. We hope that you learned something about the program. Thank you for tuning in, and we will see you next time on Health Matters.